If we look at a normal hair cycle, it's composed of three components. Anagen is the growth phase that lasts typically from 3 to 7 years. And as you age, the growth cycle length does get shorter. In the top left photograph there, that's a normal anagen hair. You then have a period of about 2 weeks in which the hair regresses and then goes into a resting phase that lasts 3 or 4 months. And this is what happens in everyone continually throughout their life. And typically for most people, you should expect to shed about 100 hairs a day. As normal washing and brushing, you're actually pulling out these telogen hairs that have actually detached from the root cells. So what happens in hair loss? What's the mechanism? You have testosterone circulating in the bloodstream, and that's converted to dihydrotestosterone by the action of the enzyme 5-alpha reductase. DHT, or dihydrotestosterone, can attach to the hair cells that have receptors for it, and these then can change the life cycle of your hair. So instead of having a long growing phase and a short resting phase, eventually the opposite happens until you don't get any growth at all. So here's our bald man. He has receptors for DHT in the bald areas, and in the hair-bearing areas that are left, he doesn't have DHT. And that's why when you see men who've got severe balding, they still have the rim of hair around the back and the sides. The number and the exact location of hairs that have receptors for DHT is genetically inherited, and it can come from either side of the family, and it's autosomal dominant. So other causes of hair loss that make up the other 5%, there's quite a number. Traction alopecia, as in this lady here, and I'll show her again later. Chemical or burn scars. Physical, emotional stress can cause temporary hair loss. Alopecia areata, medications, pregnancy, medical conditions, skin conditions, and the list actually goes on from there. Now, when we talk about modern hair transplant surgery, we're mainly talking about the top one. Scalp reductions we do, but mainly for repair works in cases like scars due to burns. Flap surgery is no longer in vogue for traditional treatment of bald men. It's reserved for reconstructive work only. So hair transplantation involves redistribution of permanent hair, and with surgery you should expect to get somewhere between 85 and 90% of the transplanted hair growing. And the actual restoration procedure is artistic as well as just simply scientific, and I'll explain that a little bit more later on. So going back to history again, let's look at history of hair surgery. It was first described in 1939 by a Japanese doctor, but it did not come into vogue for cosmetic hair restoration until 1959, when Dr. Ohrenreich, a well-known dermatologist in New York, described the donor dominance principle and started doing surgery on patients. Since then, various people have developed hair restoration to what we know it is today, and that area at the back that's marked out is what we would consider to be the zones that we would take hair from for restoration surgery. So let's look at the first techniques that were done by Dr. Ohrenreich in the late 1950s. The old technique used cylinders of hair and scalp from the back of the scalp and cored out then the bald skin at the front, and then these large groupings of hairs were put in. And as you can see in this patient, we've actually shaved down the center a bit, but you can see at the sides that he has these large groupings of hairs, and these are 4mm plug grafts. And unfortunately, it wasn't appreciated that this really wasn't a very aesthetic procedure. Having hair on your head is not the same if the distribution isn't symmetrical, and having a doll's hair appearance or looking like a Barbie doll hair really didn't solve the problem of baldness. It just created a different problem. So with today's technique, we now take strips from the donor rather than coring out plug grafts. We cut these into what we call follicular unit grafts, and I'll explain that a little bit more in the next few slides. And single hairs we plant along the hairline to create a feathery appearance at the front. And nowadays, with modern techniques, this surgery should be undetectable from the original hair. Now, what it's meant, though, in terms of our operations is that large numbers of grafts, somewhere from hundreds to thousands of grafts, have to be transferred. So it's very labor intensive, and you need a large and stable team of assistants to help you with it, and you need a custom designed operating room. Going back to the plug graft time or punch grafts, typically an operation would move somewhere between 50 and 100 punch grafts in an operation, and we're now doing over 3,000 grafts in a patient in a single sitting. So from the donor site, as I said before, we take a strip of hair-bearing skin, we cut it into small grafts, which are the natural follicular units that occur in the scalp, and we cut these out under dissecting microscopes. The donor site's sutured, and you end up with a very thin scar that's hidden underneath your hair at the back. There is another method that is used that's called follicular unit extraction, and this actually goes back to the punch grafts again, but using much smaller punches so that you can take out a single unit of hair at a time. So we're going down to from 4mm punches down to a 1mm punch. Then in the recipient site, we can either use small needles or a blade to make incisions, and the angle and direction that you make these incisions is very important, and the grafts have to be inserted one by one with very fine forceps. So if we look at an area of donor hair, the top part has actually been shaved down. The hairs are 3mm in length, so from this level upwards the hairs have actually been shaved, and these are hairs that are still long. So there we see 1, 2, 3, and 4 hairs that are grouped together, and this is what we call a follicular unit, these groupings of hairs that naturally occur together in the skin. So this is what we do with the donor site. We tape up hair above the area where we're going to take out the strip of skin, and this is typical about 1 centimeter in width, and the length that we take will depend on how large an area we're transplanting into. That area is then cut out with a scalpel blade, and then in close-up, and then that's sutured closed. So this is a patient who has had grafting done previously, and his scars there. I've put this here because there is a technique that we're using at the moment that's fairly new to hair transplantation anyway, where we are actually cutting part of the epithelium along either the upper or lower edge of the wound, and we're trying to get hairs to actually grow through the scar. So even for the back, we're trying to make the scars as invisible as possible. And where that arrow is pointing is there's a hair actually that's growing through the middle of the scar. And we're currently doing some clinical trials with this technique to find the best method of doing this. Sometimes patients do get wider scars at the back, which is very patient dependent, and anything we can do to try and disguise the scars, even though they are hidden underneath their hair, the better for the patient. So once we've got our strip out, we then have to make small slivers out of it, very narrow slivers, and we then cut that into the small follicular unit grafts. And this is just a tray where we've got lots of groups of 20 grafts on it. Those are the microscopes that we use, and that's me on the left there at a teaching microscope, and you can see on the LCD screen above that I'm actually slivering the strip, and this is in close-up. So you can see that it is very meticulous type work. You have to get these very narrow slivers, and then from those you can cut your grafts out. And